N-acetyl-P-aminophenol, a compound derived from para-aminophenol. Active ingredient and composition. Paracetamol, also known as acetaminophen, is the generic name. Each formulation contains this active ingredient as an analgesic and antipyretic. For example, a typical tablet contains 500 mg of paracetamol as the active substance. Common excipients include substances such as povidone, binder, pregelatinized starch, diluent, and stearic acid, lubricant, present in many commercial formulations. Pharmacological action. Paracetamol exerts its main effect at the central nervous system level, inhibiting the synthesis of prostaglandins, substances that mediate pain and fever, through the inhibition of the cyclooxygenase, COX, enzyme in the brain. It may also activate TRPV1 receptors in the spinal cord, contributing to analgesia. Thus, the analgesic effect of paracetamol results from a combination of inhibiting central prostaglandin production, reducing pain and fever, and modulating pain neurotransmission pathways. Conditions commonly treated with paracetamol: febrile states, headache and migraine, musculoskeletal pain, dental pain, dysmenorrhea, mild postoperative pain, symptoms of common cold and flu, common and severe side effects. Reported adverse reactions include skin rashes, mild exanthema, urticaria, or other manifestations of cutaneous hypersensitivity. Some patients may experience nonspecific gastrointestinal discomfort, mild nausea, or slight hypertension, especially with the intravenous formulation. Occasionally, mild elevation of liver transaminases or changes in hematological parameters, such as anemia or leukopenia, have been reported, usually associated with prolonged use. Very rarely, paracetamol has been linked to severe and potentially life-threatening skin reactions, such as Stevens-Johnson syndrome, SJS, toxic epidermal necrolysis, TEN, or acute generalized exanthematous pustulosis. These serious reactions usually start with fever and mucocutaneous lesions and progress rapidly. Although rare, they have been described in medical literature and pharmacovigilance reports. It is important to highlight that acute liver damage, hepatotoxicity, does not occur with normal doses in healthy individuals, but it is a serious risk in cases of overdose. Precautions in hepatic impairment. Since paracetamol is metabolized mainly in the liver, extreme caution is required in patients with chronic mild to moderate hepatic insufficiency. In compensated chronic liver disease, e.g., non-decompensated cirrhosis, lower doses are advised. In patients with glucose 6-phosphate dehydrogenase G6PD deficiency, there is a theoretical risk that high doses may precipitate hemolysis. Overdose toxicity and management. Paracetamol, acetaminophen overdose is a well-recognized medical emergency, as it can cause severe acute liver damage. In fact, paracetamol is one of the leading causes of acute liver failure worldwide. In the United States, it is the #1 cause of drug-related acute liver failure, associated with hundreds of deaths and tens of thousands of hospital admissions annually. The toxicity results from excessive formation of the reactive metabolite NAPK, N-acetyl-P-benzoquinoneamine, when normal liver metabolism pathways are exceeded. This cellular damage can progress to massive necrosis and fulminant liver failure if untreated. The kidneys may also be affected, tubular necrosis, in severe cases, as NAPK can directly damage renal tissue. In adults, a single ingestion of greater than or equal to 7.5-10 g or greater than 150 mg per kilogram body weight in a short period can cause significant hepatotoxicity. In children, doses above 200 mg/kg may be toxic, although children are paradoxically somewhat more resistant to acute liver damage due to metabolic differences. Clinically evident hepatotoxicity, dramatic elevation of transaminases, jaundice, coagulopathy usually appears 48 to 72 hours after massive ingestion, not immediately. In the first 12 to 24 hours, patients may be asymptomatic or have nonspecific mild symptoms, nausea, vomiting, abdominal discomfort, which complicates early assessment. After this latent period, if no antidote is given, right upper quadrant pain and overt signs of liver injury typically appear. Warning sign #important, medication should never be abused.